Hi, I'm Dr. Nidhi Agrawal, a consultant obstetrics and gynecology practicing at Cloudnine, Patparganj, East Delhi and Noida. So, ectopic, the word itself means which is not right in its place. So, what is ectopic pregnancy? Normally, we all know that pregnancy should be in the mother's womb, the uterus. So, when the pregnancy is elsewhere, we call it an ectopic pregnancy. It can be in the fallopian tube, it can be in the ovary, it can be somewhere in the abdomen. So all these locations would come under one umbrella, that's ectopic pregnancy. But the commonest ectopic pregnancy is the tubal pregnancy. In fact, even the fallopian tube is divided into 4 parts. So there also is ampullary pregnancy, which is the commonest. So why should one get ectopic pregnancy? The problem lies in the altered mobility of the fallopian tube, and the concerns were that does it need immediate surgery? So it really depends upon the presentation of the patient. If a patient presents to us 5 to 6 weeks or very early, once she's diagnosed she's pregnant, we do a scan and it just comes out that there's an ectopic pregnancy. In those cases, we really have options. If the mother is stable, if her beta HCG is low, the baby has not developed a heartbeat, the size is less, she is stable, so we can plan her for an expectant management or a medical management. But if the patient has presented to us with a ruptured ectopic pregnancy, what do you mean by ruptured ectopic? That the fallopian tube has ruptured, and the fallopian tube is a very vascular structure in our body. So if it ruptures, the mother bleeds. And the patients present to us with the hemoperitoneum. What's a hemoperitoneum? There's all blood in the abdominal cavity. And the patient's vitals are low, sometimes they are sinking. So in those cases, those are not the candidates for any sort of expectant or medical management, and they are the utmost urgency in obstetrics. We immediately just do their vitals, arrange blood and take them to OT. The stabilization and the surgery, they go hand in hand. And this surgery is a life-saving surgery. The moment we just get hold of that bleeding end, the patient's vitals start improving. So in those cases, definitely surgery is needed and it should be done immediately. And in the well-selected cases, we do give expectant management or give medical management and keep the patient under observation with all the risks explained. After the ectopic surgery, depending upon if the patient came to us in a really bad state in very low hemoglobin, then she would need transfusion of blood and blood products, and there the recovery would be a little slow because the patient has lost a lot of blood and there will be weakness. In those cases where the patient came in just in time, the recovery is very good, and in all the cases the patient is discharged on 3rd day of the surgery. And nowadays, with the advent of laparoscopy, we no more do open surgeries for ectopic, even if it's a ruptured ectopic. We always go laparoscopically. So in a week, patient is up and above and she can start all her office or household work except for the heavy work. So the recovery is not a problem. It's just that the general health has to be taken care of.